Hi, my name is Sue. I'm a tissue viability nurse at Tally Group. I would like to introduce the aSSKING and Support Surface Guide from Tally. This handy pocket-sized guide outlines the aSSKING framework with each of the key elements explained in detail, along with an introduction to pressure area care mattresses. And as we know, the provision of a suitable support surface is a key aspect of the aSSKING framework. The following video will focus on the aSSKING framework, and there is also a separate video which will concentrate on support surfaces.
As I've mentioned previously, this guide outlines the aSSKING framework with each of the key elements explained. So if we look at how and why the aSSKING framework was developed, we have to start with the original 5-step aSSKIN care bundle approach to preventing and managing pressure ulcers. This care bundle has been established for many years and is widely used in clinical practice, with evidence showing that it helps improve clinical care. The original aSSKING care bundle focuses on skin inspection, surface, keeping your patients moving, incontinence and moisture, and nutrition and hydration. And then in 2018, NHS Improvement published a pressure ulcer core curriculum document to help guide education for nurses and other healthcare professionals on preventing pressure ulcers. And taking the existing aSSKIN model into account, they added 2 important additional elements for preventing pressure ulcers, these being A for assess risk and G for giving information. So this is where we've got our aSSKIN framework. While the core aSSKIN acronym remains unchanged and represents the fundamental elements of care delivery for the prevention and, when necessary, management of pressure ulcers, the 2 new additional elements of assessing risk and giving information underpin and support the successful implementation of care. Since the release of the pressure ulcer core curriculum in June 2018, there's been a dedicated educational drive to raise awareness and implementation of the aSSKING framework, and it's now being adopted across a range of care settings where it forms an essential part of patient care plans. The aSSKING Care Bundle is a tool which guides and documents pressure ulcer prevention and is aimed at reducing the risk of this often preventable patient harm. So if we look at each of the elements in turn, starting with A, it's important that we assess pressure ulcer risk using a validated tool to support clinical judgment. And this risk assessment helps us identify the patient's individual risk of pressure ulcers. And then appropriate care and interventions can then be implemented, ensuring resources are used appropriately. Moving on to skin and skin care. So early inspection means early detection, and it's important that we perform regular skin inspections, but it's also important to show patients and carers what to look for. And more information for how this can be done and what to look for can be found in our pressure ulcer patient and caregiver leaflet. And then we've got surface selection and use. So it's important that we ensure the provision of appropriate pressure reducing or pressure relieving devices. And it's important that we understand the different types of PAC mattresses. And as I mentioned previously, this is outlined in the pocket guide, and it also covered in a separate video. It's important to ensure the patient is repositioned at regular intervals to meet their individual healthcare needs, and also consider the 30-degree tilt to position the patient. It's important to keep our patients moving, so encourage mobility and regular movement to relieve pressure over bony prominences. And also it's important to assist patients who are unable to move independently. Then moving on to I for incontinence assessment and care. So it's important that we keep skin clean and dry, and this may include the use of barrier creams, incontinence products and or emollients, but it is key to remember that it's important for a continence assessment to be carried out when necessary. Nutrition and hydration assessment and support. Again, it's important to assess nutritional status and also keeping patients well hydrated, and also to implement prescribed diet and nutritional supplements. And then lastly, giving information. It's important that we communicate effectively and provide information to patients, carers and the multidisciplinary team regarding pressure ulcer prevention, and this will include things like repositioning, equipment, nutrition and hydration. And providing this information verbally is important, but it's also useful to provide written information where possible. For example, our pressure ulcer patient and caregiver leaflet. Further information on the aSSKING framework can be found by accessing the website shown here, with other useful links also shown. If you would like a copy of this guide, please visit our website shown on the screen here.
Thank you for listening. I hope you found this video useful.